Go.
Hello, everyone. I am Leslie Marquez.
And I'm Elmer, and today we will be arguing on why vitamin D supplementation is an effective treatment for depression. Depression is defined as a mood disorder which emits feelings of despair, detachment, adversely affecting the quality of life. Approximately 280 people worldwide suffer from depression, according to the World Health Organization. Um, there are 5 classified depressive disorders, which are currently managed by medication, counseling, and addressing nutrient deficiencies. It is important to address depression since it can lead to self-harm, suicide, and social economic burden on society. While depression is a complex health issue and many environmental factors can be a cause of depression, biological factors also play a role, such as neurotransmitter disruptions, inflammation, and several chronic diseases. What all these factors have in common is that these biological factors are regulated through vitamin D.
Okay, so overview of vitamin D. So vitamin D is obtained through diet intake and dietary supplementations, and there's two types of vitamin D. There's D2 and D3. D2 comes from plant sources and D3 comes from animal sources. However, it is difficult to obtain sufficient daily vitamin D from dietary intake. So the majority of vitamin D is produced in the body through absorption of sunlight, through skin exposure, and so vitamin D deficiency is prevalent in the United States, especially in individuals with darker complexions. And it is important to address vitamin D because it is crucial for brain properties and functions. Study number 1 by Burton Johnson suggests that vitamin D has important functions in the brain and may play a role in depression. Vitamin D receptors are found in the brain regions which are linked to depression, such as the prefrontal cortex and hippocampus, meaning that vitamin D might directly interact with these regions involved in mood regulation. So cells in these brain's regions can convert 25 hydroxy vitamin D into the active form of vitamin D, which is important because the active form of vitamin D may have direct effects on the brain.
Vitamin D has been proven as an effective in treating depression in an 8-week clinical trial. A study published in the Journal of Affective Disorder was conducted in Iran between May 2018 and June 2019. This study was an 8-week double-blind randomized controlled trial, which is the gold standard in research. This study looked at 56 participants whose average age was 43 that were diagnosed with mild to moderate depression on the Beck Diagnostic number 2 test. These individuals were also vitamin D deficient. The participants were assigned to 2 random groups. The intervention group was administered 50,000 IU of vitamin D3 every 2 weeks. The control group was given a placebo. The outcomes of the study showed an 40.83 mole increase of 25 hydroxide vitamin D, which is a biomarker used to measure vitamin D in the bloodstream. In Beck's scale, with a maximum score of 63, the intervention group points decreased by 11.75, while the control group decreased by 3.61, which proves vitamin D is an effective intervention for treating depression.
Okay, so to wrap this up, research shows vitamin D supplementation can alleviate factors that contribute to depression. So when combined with medications, therapy, and other interventions, vitamin D is valuable in managing depression. So in conclusion, we're not saying that vitamin D is a standalone cure, but for many individuals who are vitamin D deficient, it is important for an effective treatment. So based on research, yes, we would recommend vitamin D as an effective treatment for depression. Thanks for watching, everyone.
Thank you, and here are references.